trial on each one. Oh, how many? I'm probably at the 300 or more point.
And how many people were cured? Or
Closer to 500.
Closer to 500?
Yes.
So how many people out of that number had either cancer or AIDS?
Oh, those are the ones that had cancer. I'm talking about
I see.
cancer.
And how many were, it's out of the body now? How many people out of the 500, say?
That no longer have the malignancy?
Right.
All of them.
All of them.
It's absolutely successful. This isn't a quantitative effect where you're partly successful. If you kill them, they're gone. That was the other very startling part about understanding cancer. Because it is a parasite-caused disease rather than some chronic degenerative illness kind of disease, you can simply kill the parasite and then you're gone. Then you're rid of it. And it doesn't live up.
Now, when that happens,
yes,
do you have to do some sort of maintenance program? Or?
Yes, you do.
And what does that consist of?
You keep on using these herbs to keep killing the new parasites you pick up. Mind you, it's not very easy to pick them up once you know where they are.
Now, wait a minute. You pick up. How do you pick up parasites?
Eating a raw hamburger.
Raw meat.
Yes.
That has
Yes.
the parasite in it?
Yes, the parasite stages.
Uh-huh.
I have photographs of it in the book because I was pretty shocked. I thought that maybe somebody was looking at this meat for us and making sure that there was nothing like that in there.
Right.
But I suppose they do that, and they just never thought that these could be there, and you never find things you don't look for, you know, so
Exactly.
I think that's why it was...
That must have startled you.
Well, it sure did startle me, and I then went and looked at ground turkey. It was there. Ground chicken, it was there. I didn't bother looking at ground pork because I know we always eat pork very well done.
Right.
Whereas hamburger is thought
medium rare,
safe
juicy,
enough.
you know, exactly. That's the way that we all have ordered them in the past, anyhow.
Yes. It's much more prevalent now, I'm sure, than it was in the past.
Uh-huh.
And there is a reason for that.
Well, that's a pretty scary thing.
Yes, it is. That was another reason I thought I had better make it public information.
Exactly, and we do appreciate that for sure.
Thank you.
Now, I have, in breezing through your book there, actually it wasn't in the book, I've heard this, that you have a maintenance program that you don't have to take the pills anymore or the cloves anymore, but an electronic zapper device or something? What is that?
That is probably intended to be referring to the electronic circuit that is discussed in the book.
I see. And how does that work?
With that, you can monitor yourself to know whether you have the cancer and whether you have routed it. When you're done with your, after 5 or 6 days on the parasite program, you want to know if you're rid of it.
Mm-hmm.
So with that circuit, which is very easy to build, you can monitor yourself.
I see. So that's just a monitoring device.
Yes.
It's not nothing that takes the place of taking the cloves and...
No.
I see. I didn't realize that. All right, let's jump to this other book, the HIV and AIDS. What is HIV? There's so many stories going around that...
Right. But this story is based only on my observations.
Okay, I understand.
So I don't have any other interpretations of it, only what I saw.
Okay.
And I saw that when I killed the same parasite as we've been talking about, all the stages, then the HIV virus disappeared within hours, just as fast as the cancer growth stimulant did, in people who had HIV. Of course, it's easy to find the virus if you use this electronic circuit I'm telling you about.
Right.
And then you find the parasite in yourself. You can find all the little stages and find in which organ they are easily with this electronics. And then you kill it.
Right.
In 5 or 6 days, you have all the stages dead. And then you can recheck and find that the virus is gone. So you might say it was just a bonus. You don't have to kill the virus.
So...
just kill what is bringing it in.
All right. Now, here's a more specific question. What's the difference between HIV and AIDS? I'm a little confused.
Very big difference.
I'm confused in this. What is that?
AIDS is a condition of low immunity, so that you're getting all kinds of illnesses, such as the common illnesses that you may have had in childhood, or that are all around us, but ordinarily we don't get sick from it because our immune system, our white cells, are adequate to gobble them all up. But in AIDS, you don't have that strength, that immune strength. Whereas the virus, that's a different thing entirely. It comes in with its parasite. But when you have a solvent, benzene, accumulated in you, which goes to the thymus gland, that is when the parasite is invited to the thymus gland. I know that's very complicated, but it is in some way analogous to the cancer situation. Maybe because it's the same parasite, there are some similarities. In cancer, remember, there is the parasite and the solvent, isopropyl alcohol, playing a role. Each of them is playing a role that complements each other somehow and causes it to multiply in an organ and make that growth factor. Now here in HIV and AIDS, you have a solvent, benzene, this time, which is causing the thymus to be so run down, and the bone marrow to be so run down, that the stages, the intermediate stages of the same parasite are now reproducing right there. So for cancer, you might have cancer of the breast or prostate or somewhere, and they're reproducing there. In HIV/AIDS, you have it reproducing in your thymus and bone marrow. And since that's your central immune organ, why, it just knocks you out. It would be as if a fire in your building knocked out your water sprinklers first off.
That is phenomenal. Hulda, may I call you Hulda?
Sure.
Hulda, is there any side effects in taking these alternative means?
No, none whatsoever. I have a recipe in the book that is gradual, which then, reduces the probability of side effects. So I think if you went on a crash program of taking the maximum amount the first day, you would have, but not with a gradual program.
So out of all those people that you've met with, not one person has had any, like I know some drugs sometimes that you take?
Nothing like that. Nothing like that.
That is phenomenal.
That's herbs in general. I have rather good attributes like that.
On a more personal note, how has this affected your life?
Well, I suppose it has turned it into a mission. I have to somehow get the word out to the people who are suffering that there is a cure, and that it isn't expensive. They can do it themselves, and they can be successful. It isn't a matter of luck at all. And because it is difficult to get word out, even about something as good as finding a cure for cancer, I have to devote my life to it at this point. Fortunately, I have a very good publisher who's doing most of it for me.
Hulda, have you had any kind of, let's say, mail that have had testimony that people that you didn't work with?
Oh, yes. Yes, I get lots of mail with testimony that they recovered, that they had been terminally ill. I get phone calls, too, but of course I'm really way too busy, and my staff is too busy. We don't keep a record of these. There's some that are, they stick out in our memory, but as a whole, there is so much good response out there. It really would take a whole team of workers to keep track of the results.
In the patients that you've been with, what has been, not the person's name, but how far have they been gone, like diagnosed 3 weeks to live or something like that?
Oh, yes. I get those.
That much?
Yes.
And they are still living today?
Some of them, yes. Not all of them. But I would say that we have a pretty good percentage success, even with people that have only 3 weeks left.
3 weeks left?
Yes, I would say that we're salvaging, saving about 80% of them.
Now, does this treatment at all conflict with any other treatments? Let's say if a person's on a drug here or a drug there?
No, it doesn't conflict with anything. Herbs like these don't. And that's the good thing about herbs. That's why I went after an herbal treatment for these. I started out, of course, with the usual clinical treatments for parasites.
Right.
but realizing how harsh they were,
Mm-hmm.
and with my training in homeopathy and